Welcome back, everyone. Today's podcast is going to be about Medi-Cal, the coverage, and who is now being able to be included in the extension. So let's get into it, everyone. We're going to be talking about the new implemented older adult expansion. Its formal name is Assembly Bill 133, Chapter 143, Statutes of 2021, Amended Welfare Institutions, Code Section 14007.8. With the collaborations of counties, Medi-Cal managed care plans, advocates, community-based organizations, the legislators, this has been implemented since May 2022, and this has been a long year coming, everyone. Yes, it has been a couple years since it has been available to everyone in the public of the California state. However, it is still very new and still very fresh. And the awareness of it is we're one of the things we're going to be talking about today. The purpose of this policy is to expand eligibility for full scope Medi-Cal to individuals who are 50 years of age or older, regardless of citizenship or immigration status, if otherwise eligible. So, this is what's happening now. They have made this for younger children and youths a couple years ago, and we are now transitioning into making it for older adults. And these individuals have been able to have Medi-Cal. However, they had a limited Medi-Cal. Now it's transitioning to a full scope Medi-Cal for those who are 50 years of age or older. The first goal that we can just, clearly see is that it is for, eligibility for those who are 50 years or older to have, full scope Medi-Cal. That is what we can clearly see. I would say a hidden goal that we can't, people don't see unless they're experiencing it themselves. And it is when you have to wait to get Medicare, coverage when you're at the age of 63. And so you're in that kind of transitional age from 50 to 63 of having that restricted Medi-Cal rather than having to have a ability for full scope Medi-Cal, and then waiting in those years until you're able to qualify for Medicare. So we can see that we want the older adults to have the full scope as the main clear goal, but then we can also see that for those who don't experience it and don't have to quite wait, but are having to wait, are seeing that we're wanting to fill that gap and not having to have them go so long with restricted care. Now let's get into the social problem that California Department of Healthcare Services is wanting to address. So they have always disclosed and shared with their entire state and the rest of the nation that they are striving to preserve and improve the overall health of all Californians. Recent estimates show that the following eligibility expansions: the Medi-Cal program now provides health coverage for approximately 1/3 of California population. The program's population growth has been the subject of much discussion recently, but less understood is the significant degree of the variability between counties concerning the proportion of their population that is enrolled in Medi-Cal. So another social problem that people would need to consider is that the primary business of healthcare today is managing chronic conditions. Approximately 75% of healthcare expenditures are from chronic conditions. Now, this little stat right here is actually coming from UC Davis. This was something that they had done research in back in 2015. And that's basically what Department of Health of California is wanting to address. Making sure that we're able to maintain and continue to provide those full coverage services to Californians. And when we see things like chronic pain and chronic pain management or chronic illnesses needing to be taken care of, but not being able to receive their full coverage, that is something that legislators, advocates, as well as community-based leaders are continuing to strive for. And with things like the older adult expansion, filling that gap so people don't need to wait that long to receive full coverage is one of the many stepping stones that we have now been able to reach as a state. So, does this policy have sufficient detail to allow for a full analysis of its potential to achieve the stated goals? Well, I would say it has been 2 years, so yes. I did find one analysis, and it was mostly to discuss how has the awareness been done since implementing it. And, there wasn't that many people who were fully aware of it when it was first launched, but they were all very motivated to be enrolled and to make those next steps so that they can receive their full scope of their Medi-Cal coverage, now that they are meeting that transitional age gap. Has impacted and also left out a vulnerable population. California legislators expanded full scope Medi-Cal coverage to include undocumented immigrant adults 50 years of age and older beginning in May 2022. The initiative addresses federal restrictions on Medi-Cal funding and is financed with state funds. California expanded full scope Medi-Cal coverage to all children in 2015. Another expansion in 2020 covers young adults, and a final expansion for this one was for undocumented adults, as well as, citizen adults in California. Age 26 to 49 takes effects in January 1st, 2024. So since 2022, it was for Californians, May 22nd, the older adult expansion, but it was supposed to be now transitioning for a final expansion. The undocumented adults aged 26 to 49 takes effect as of this year, 2024. Using the response from our key informants. So I took this information from UCLA, who was actually the one who went and did their full analysis to, discuss the implementation since, the policy has been taken into effect. They have noticed there are some, factors that are playing into what is sort of creating a dilemma, if you will, with a lot of the individuals who are wanting to participate. One of the things that they noticed is technology. Another thing is language barriers, and another thing is immigration status. So something that Department of California Health does always notify whenever they are promoting, Medi-Cal to undocumented immigrants is that they always say to consult with an immigration attorney. So that right there is something where how can they really trust what is available to them? Is this really what California is trying to fully promote? Are they really trying to say that Californians are being able to receive full, medical coverage? Well, everyone, we will wrap up today's podcast with this last daunting question, especially for us social workers who are listening in today. Is this something we can support? Is this something that needs to be changed? What kind of recommendations can we make for this policy? Well, this is definitely something me as a social worker I'm wanting to support. Obviously, there is always room for change and growth. When something is brand new and takes effect, we will see what types of gaps are needing to be filled. And it is a major discussion whenever it comes to what type of income is going to be the threshold keeping individuals from being able to receive full Medi-Cal coverage. And also the discussion of the undocumented individuals, is this something that they can really participate in safely? There's just a lot of gaps that can be filled. And I would say the changes, we can see in the future, it's going to be a lot of table discussion, because to have even been able to reach this far, being able to have full coverage scope for children, young adults, and older adults has been an accomplishment on its own. But you know what, guys? That's enough for today's podcast. Thank you so much for tuning in.